Cancer cells is a topic that I'm going to treat today. A lot of people don't know what goes on inside of them. The prevalence of this cancer is too high in these days we are living in. So if you don't take preventive measures to make sure that your immune system is boosted on a ready 24/7, you may be at risk. Do you want to find yourself having blood cancer? There are many types of cancers out there. You don't even know. They are the ones the doctor cannot even tell you. Cancer is real. We have cancer of the blood. We have cancer of the brain. We have, of course, prostate cancer for the men, colon cancer, ovarian cancer, lungs cancer. There are too many. Like I said before, there are the ones the doctor cannot even, they have not even yet discovered. So why don't you take precautionary measures and be in a safe place? Now listen to what I'm going to tell you today. When it comes to cancer, how does it even happen in the body? It's as a result of DNA mutations. DNA mutations in the body, in your cells. Once this starts, it spreads quickly to the point that your immune system cannot catch up with it. If your immune system is even those who have normal immune system, it is still difficult for the immune system to catch up with this cancer cell, because the way it grows rapidly, within the twinkling of an eye, the thing is just spreading. That is why you must go for checkup every now and then. Always check your blood. Go for checkup, because you wouldn't even know when it gets to stage 1. There are different stages of these cancers, and once it gets to stage 4, that is when, oh my dear, the cancer has already spread to various parts of the body. There's nothing you can do again. Then you will now be reduced to be placed on a conventional treatment such as chemotherapy. And is that the solution? I've met with cancer patients. The other day, I was called upon to come and check a cancer patient at the hospital. And then I went there and met with the oncologist. And he was reading all these books for me, telling me things that I didn't want to hear at that particular time, because we needed to save, the family of the patient needed to save their sister's life. And let me shock you, the patient I went to see that had cancer has been a matron in NNPC company for 35 years. So when cancer is striking, it doesn't look at the face of whether you're a medical doctor. So long as you are not doing the right thing, my dear, cancer will come visiting. If you want to take precautionary measures or preventive measures, it shouldn't be the drugs you are depending on. Maybe she depended on that orthodox medicine, conventional medicine. She was just taking it. She was just there, and the body was just yearning, crying for natural remedies to help boost the immune system. But she paid deaf ears. Or maybe it is as a result of ignorance. It could be ignorance, because she's high up there. She has read all the books in the world, which gave her that position she was handling. She has treated a lot of patients, even maybe cancer patients too. But she neglected her own immune system, her own body, and what she was eating too. When I went there, the family called me. I told them they must remove her from the hospital. I'm just giving you this short experience. I told her they must remove this matron from this hospital, because she was moved from the NNPC hospital to one other private hospital. They said they can handle cancer. I was like, why would they not be able to handle it there? Why sending her there? Well, I said, if you want me to intervene, please remove her from that hospital before I can not come in. There's no way we can be missing conventional with our own remedies. It will be conflicting. It will be too conflicting. So, but the doctor refused to let her go. They cannot just let her go, because to them, they feel that chemotherapy will do the work. which it never did. Until I went there, met with her, and I prepared my concoctions, my herbal things, which I know is the first thing to do to boost the immunity as a naturopathic doctor. I tried to do that, but when she was able to see, to look at me and then open her eyes, she was so pale when I got there. Her skin was as white as this pepper here. So I was like, the doctors were not even concerned about no boosting her immune system and making sure that she has energy before even placing her on chemotherapy. So they were just so when I met the oncologist, we tried to as in explain things to him, to see reasons with us for us to come in and interfere. You understand me, with our own remedies. He actually told me that he believes in our conventional, our therapists, natural therapists, you know, that but right now they needed her consent for her to leave the hospital before I can treat her. That if she doesn't give her consent, there is no way they will allow me to treat her. So that was the reason why I went there, of course. And then I spoke with them. And then the family were pressurizing them that they should release her to me. That they believe that I can perfectly manage her condition. Although I told them that I needed to know the stage this cancer was before I can even intervene. They denied me that. They didn't want, because they wanted me to come and try my best. They so much believe because they've had experiences. So they forgot to come initially. And so the oncologist decided not to release her. Oh, they had to force me to the bed she was. She was, of course, bedridden. I went there, touch her, but look at, she was so pale and so weak. Her eyes were sensitive to light. The room was dark because they had to put off the light 24/7. And she was sensitive to cold. When I saw all of those signs, I was like, no, this is, despite the fact that these people don't want to tell me the stage this cancer is, I know where it is. I know the stage. This has already gotten to the bone marrows and everywhere. It must have affected the brain too, because she was acting weird. She wasn't corresponding. So when I went to the room, it was so cold and they had to off the AC, no fan. And I was sweating profusely. Even the relatives couldn't stand it. I told them, this woman is not, ask her a few questions. She couldn't answer. I told them, oh my goodness, can you just remove this woman? Take the action by removing this woman away from here. Take the responsibility of handling her case. Talk to the doctor. They said there's no way they can do this. So they had to go back to pressure the oncologist. So to cut a long story short, that was how I left there, mixed all my things. I gave it to her. She took it and was like, she couldn't even take it. I knew that she was gone. We should be very, very careful. When there is these mutations in the DNA cells, it spreads faster. And if your immune system is not able to catch up with it, it becomes a very serious problem. At that point in time, it is not hospital and drugs you need. You need to, first of all, boost it. And one of the powerful seeds that I'm going to let you know today is this black seeds, Nigella sativa. That's the original name it's known for. But popular name is black seed, but the original name is Nigella sativa. If you don't arm yourself with this seed, it's so powerful that it has anti-cancer properties. Yes, black seed is very powerful. Most people don't know this. I'm telling you this for free. The two powerful anti-cancer properties you can find in black seed is Thymohydroquinone and Thymohydroquinone. Okay? So when these two seeds come in contact with cancer cells, my dear, it suppresses, it kills the stem cells, the cancer stem cells. There's a cancer stem cells in your body that it will stick to. And from there, right from there, it keeps spreading. But if this seed attacks that cancer stem cells fastly, quickly, so that your white blood cells can be revived, can be boosted. You understand? So if your white blood cells are boosted, you will now have the needed immune system to be able to fight the spread of these cancer cells. Most people don't know this. What do you put in your first aid box Sometimes when I go to patients' houses and I see their first aid box, what I see there is paracetamol, anti whatever, it's drugs. I'm not disputing the fact that these drugs is good, but there are cases you don't use drugs. When your immune system is very low, you don't need drugs. You don't need drugs at that instance. What you need is nature, natural things to first of all boost your immune system so that these drugs can even work. Because cancer cells will make your body to be sensitive to drugs. You understand me? You cannot take them, your body start reacting. It is not working again because it is oversensitive. You understand? So what you need to do is to first of all boost your system. When your immune system is boosted, then it is the immune system that helps to fight this thing, these diseases. So your attention should be more on boosting your immune system. What are the things to use? It is this seed here, Thymohydroquinone and Thymoquinone and Thymohydroquinone, the two powerful anti-cancer properties. Let me get it right for you. Thymoquinone and Thymohydroquinone is the two powerful anti-cancer properties that you need to fight cancer. It is found in black seeds. This is mine here. I chew them every now and then, especially to fight the blood cancer cells. The blood is the source of life. So once cancer attacks your blood cells, oh my dear, nothing again, or nothing you can do again. So you start now. Put this Nigella sativa oil in your first aid. That is the things you should have in your first aid. Not all those orthodox drugs. Put all of this. You can mix it with carrier oils like coconut oil. Just a teaspoon or a teaspoon. Mix it with your carrier oil. They won't have the liquid ones here. Okay? So once in a while, I drink them. You can use it on your hair. You can use it on your even skin cancer. There are skin cancer. People have skin cancer. They don't know. They mistake it for something else. You could rub it there. You are choking. Maybe you're having something stuck on your neck, on your throat. Carry the oil and mix it and drink. You see, they call it magic oil. Something that has been researched on like this that has these powerful properties. Why can't you have it in your first aid? It can be used for children. But first of all, consult your doctor. And it's not the doctor to consult, not the orthodox medicine practitioners out there. You consult your naturopathic practitioner, someone like us, because we are living in two worlds. Despite the fact that we are trying to see how we can synergize to help the teeming population out there that are having or suffering severe diseases that needs to be cured naturally. Please, they don't believe in us so much. They believe in ourselves and the power of nature. Please include this oil in your first aid box or even the seed. Get them. Just throw like half a teaspoon in your mouth and chew it. Chew it. It fights toothache too. But chew it. Gargle it with warm water and swallow to arm yourself. Okay? It's enough for today. Please subscribe and wait for more. Thank you for watching. Bye.